Okay, so now we're going to put our focus on the femur, the bone that makes up your thigh. Okay, now first you can see there's a distinct rounded head of the femur. Okay, so this is where the femur attaches to the acetabulum of your coccyx. And then you see there's this little hole, or what's called a fovea. Okay, now a fovea is a pit. Now basically here there's a little ligament that's called, the ligament of the head of the femur that inserts, or that helps attach more securely the head of the femur into the acetabulum of the hip. Okay, so that's the fovea capitis, okay, to be specific. And now we have the neck of the femur. Now this is an important anatomical landmark to know, okay, because when people typically fracture their hips as a result of osteoporosis, this is where the fractures occur, okay, because as you can see in the upper ends of long bones, or what's called the epiphyses of long bones, there's lots of spongy bone. As you know, spongy bone is weak. Okay, not as weak as compact, or not as strong as compact bone. So what happens then is this spongy bone starts to degenerate, and then you form these big, large pores. And this is a thin piece of bone. So a lot of times body weight, excessive amounts of body, a lot of times his neck can't even handle your own body weight. So then what will happen is a person will break their hip and then fall. You see on the TV commercials when a person's on the ground, they say, "Help, I've fallen, I can't get up." Okay, what really happened was they didn't fall and break their hip. They fell as a result of their hip breaking from their own body weight. Okay, and then now you see a structure called a trochanter. Okay, trochanters are only found on the femur. Okay, just like tubercles are only found on the humerus. Okay, so it should be pretty easy to tell the difference between the greater and the lesser trochanter. You wouldn't even have to be able to look at them. You could just tell by the name that the greater trochanter is larger in size, and the lesser trochanter is smaller in size, and it's also more inferior and a little below. Okay, and then you have the shaft, or the body of the femur. Okay, and then you have epicondyles, and then you have condyles. And then on the anterior side, you have a smooth surface called the patellar surface, where your kneecap or your patella glides along here when we're creating movement. Okay, and then there's a little bump right here on the medial epicondyle called the adductor tubercle. This is a spot where the adductor magnus muscle comes in and inserts. So it's constantly pulling on this area, so there's a little lump right there where there's constant stress because of that muscle. And now if we go over to this side, you can see a posterior view of the femur, and you can still see all these structures we just described. The head, the fovea capitis, the neck, greater, lesser trochanters, the shaft. You can see these smooth, rounded condyles. You can see these epicondyles and the adductor tubercle. But there is one structure that's unique to the posterior side of the femur, and that's called the linea aspera. Okay, the linea aspera. Now what the linea aspera is, it's a small elevated ridge, and this is where your adductor muscles are found. Okay, so your adductor muscles, or what they're often called your groin muscles, they're constantly pulling on this area of the leg, or the femur, the thigh, I'm sorry, and constantly putting stress on this area. So that's why these ridges are slightly elevated, because remember, bones constantly remodel or change their tissues to compensate for different amounts of stress that are actually put on them. Okay? So now let's actually take a look at these landmarks on a bone itself. So here we have a femur. Okay. Now first you can see the head of the femur. And then this area where this screw is sticking in, this would be the fovea capitis, where the ligament of the femur would be. Then you have the neck of the femur, greater trochanter, lesser trochanter, the shaft, the smooth patellar surface, medial lateral epicondyles. Okay, now if you were to look at this, how could you tell, if you were to look at the femur, how could you tell which would be the medial, which would be the lateral epicondyle? Think about it. The head of the femur has to attach to the medial or inner portion of your coccyx. So the head of your femur is always pointing towards the middle portion of your body. So therefore, this would be the medial epicondyle. Okay? And then if we flip this around, you can see a slightly elevated ridge. That's the linea aspera. Okay, and you can see these very rounded condyles that rotate on the superior aspect of the tibia when we're trying to flex and extend the knee. Then again, you can see the lesser trochanter, greater trochanter, the neck, the head, and the fovea capitis. Okay. So now let's shift our focus down towards the tibia and fibula. Okay, let me flip to those real quick so I can show those to you. Sorry, guys. Okay, now the tibia and fibula, these are the two bones that make up your leg. Okay, now remember, your femur, the area where your femur is located, that's called your thigh. Okay, the area where your tibia and fibula are located is your leg. Okay? So now let's take a look at these. Your tibia is much larger. This is the medial bone of your leg. Okay, and your fibula is on the lateral portion of your leg. Now what's interesting is your fibula does not actually bear any body weight at all. It does not take any stress from body weight, which is really interesting, which kind of begs the question, why do we have that bone there? And that would be the million-dollar question, because we don't really know for sure. Okay. Now, if we look at the tibia, okay, you can see that it has a very enlarged head. Okay, very enlarged head. Now, if you look at the tibia on the superior surface, okay, you can see that there are smooth surfaces here. Now, this is where your menisci are located. Okay, your menisci meaning the tough fibrocartilage of your knee. So this is where your medial lateral meniscus would be. Okay, so then, you know, your femur, what it does is these smooth condyles rotate along here to create movement, flexion and extension. Okay, so this would be the large head of the tibia. Now this little bump right here is called the tibial tuberosity. Now that's an important little area to remember, just because this is where your patellar tendon or your patellar ligament, depending on who you ask, inserts. Okay, so your four quadricep muscles form one large piece of connective tissue, which is often what we call either or patellar ligament or ligament, or ligament or tendon, depending on who you ask. It inserts right here and is constantly pulling and putting stress on this area. So that's again why there's a little elevated ridge here. Okay, and then you have the medial and lateral condyles, not epicondyles, condyles, I'm sorry. Okay, then we have the shaft of the tibia, and then we have this little structure right here called the medial malleolus. Okay, now the medial malleolus, if you were to go palpate your ankle, that would be that large bump on the inner portion of your ankle, the medial malleolus. Okay, and again, this kind of, just like the carpals or like the styloid processes on your bones of your forearm, this is kind of like a little cusp for your carpal bones to kind of sit right in to help form the ankle joint. Okay, so then the fibula, as you can see, is pretty simple. Okay, the fibula, basically we have a head, a shaft, okay, and then we have the lateral malleolus. Okay, so we've got the head, we've got the shaft, and then we've got the lateral malleolus, okay, which forms that big lateral bump on your ankle bone right there. And then, like I said, your tarsal bones sit right in that groove, and then that's where we have the ankle joint. Okay, now let's take a look at all this structures put together. So we have the femur, okay, and then we have the patella or your kneecap, okay. We have the tibia. This would be the head of the tibia. This would be the superior faucet where the menisci are located. This would be the tibial tuberosity where your patella tendons all form, or where they insert from your quadricep muscles. You have the shaft of the tibia. Then you have the medial malleolus. Okay. And then on the lateral portion, you have the fibula. This would be the head. This would be the shaft. And then this would be the lateral malleolus. So now let me ask you this question. Is this a left or a right leg? Think about it for a second. Okay. Look at where the head of the femur is pointing. Remember, the head of the femur is always pointing towards the medial or inside portion of the pelvic area. fibula is on this bone is always going to be found on the lateral aspect of the leg itself. Okay, this is the medial malleolus. This would be the lateral malleolus. So which leg would this be? If you were to just take a look at this, what would you say? Right or left?
Right.
Right, that is right. It's the right leg. Okay? And then as you can see here, in your ankle joint, you can see the various tarsal bones. Okay, so these are the various bones of the thigh and the leg that I want you to know and understand in the various landmarks.